Hey there, and welcome. Today, we are going to pull back the curtain on hospital safety. We're going to get into this really powerful, evidence-based system that's designed to protect every single patient. Okay, let's jump right in.
It's a question a lot of us have, right? Especially when we or someone we love is feeling vulnerable. And from the outside, it can seem like this incredibly complex maze of rules. But there's actually a very clear, internationally recognized system working behind the scenes.
And this is the heart of it, the International Patient Safety Goals, or IPSG for short. Honestly, you can think of it as the global playbook for safety in healthcare. And this isn't just a list of nice suggestions. It's a whole framework built on hard data and expert agreement, all focused on fixing problems before they can cause any harm.
So, here's what we're going to walk through. We're going to break down 5 of these core safety goals, one by one. And then, we'll talk about the super important role that you play in all of this. We'll hit on patient ID, communication, medication safety, safe surgery, and keeping infections down. So, let's get to it.
Okay, let's start with what is probably the absolute foundation of safe care, making darn sure that the right patient gets the right treatment every single time. It sounds so basic, doesn't it? But getting this wrong can have some really serious consequences.
And that's really the key here. A simple mix-up isn't just some small oopsie or an inconvenience. It can literally set off a chain reaction of dangerous errors. This goal is all about stopping that chain reaction before it can even get started.
So how do they do it? Well, this is the solution, and it's brilliant. The 2 identifier rule. This is exactly why a nurse or a doctor will constantly ask for your name and date of birth or why they scan your wristband. They're not being forgetful, believe me. They are carefully following a critical safety rule. And notice what they can't use, your room number. Why? Because you might get moved to a different room. But your name and birthday, those stay with you.
All right, let's move on to goal number 2, and you'll see how these start to build on each other. So once we know for sure who the patient is, we have to make sure all the information about their care is being shared clearly and accurately between all the professionals looking after them.
Just think about it for a second. Think of all the handovers that happen in a hospital. A nurse ending her shift and briefing the next one. A patient moving from the ER up to a surgical floor. Each one of those handovers is a point where a critical piece of information could get dropped. Kind of like a game of telephone, but with much higher stakes.
Now, this is a really fascinating part of the system, how it prioritizes information. See, not all bad news is the same. An abnormal result, yeah, that needs attention. But a critical result? That means something is potentially life-threatening, and it triggers a whole different immediate process to get that info to the right doctor right now.
And to stop those communication breakdowns we talked about, hospitals use a standardized handover process. It's like a structured conversation, often with a checklist, to make sure all the key info gets passed along. And, maybe most importantly, it creates a moment for the person taking over to ask questions and get clarification on anything that's unclear.
Okay, next up is goal 3, and this is a huge one. It can get pretty complex, but it's absolutely vital. Improving the safety of medications.
So the system is smart and recognizes that some medications just carry a way higher risk than others. They're called high-alert medications. It's not that mistakes happen more often with them, it's that if a mistake does happen, the consequences can be really, really bad. So, hospitals built extra layers of protection around them. Things like special bright labels, keeping them locked up, or even requiring 2 different nurses to double-check the dose before it's given.
And check this out. This is one of those simple, clever little tricks that helps prevent massive mistakes. Lots of drug names look or sound really similar. To stop a mix-up, tall man lettering uses a mix of uppercase and lowercase letters to make your eyes focus on the parts of the names that are different. So simple, but so effective.
Tallman lettering is just one tool in the toolbox for preventing what are called look-alike, sound-alike, or LASA errors. Besides the cool lettering trick, hospitals will also make sure to store these drugs far away from each other on the shelf. And more, they're using barcode scanners to digitally confirm that the pill in their hand is the exact one that was prescribed.
All right, let's move on to goal 4, which tackles a fear that I think pretty much anyone has if they're facing a procedure, making absolutely, positively sure that surgery is done safely and correctly.
The master plan for this is called the Universal Protocol. It's a standardized 3-step process that was designed for one reason and one reason only: to make devastating errors like operating on the wrong person, the wrong body part, or doing the wrong surgery altogether a thing of the past.
The whole protocol is broken down into 3 clear, critical steps. First, there's a verification process before the operation to make sure all the documents, consent forms, and tests are in order. Second, the surgeon actually marks the correct spot for the surgery on the patient's body. And third, there's a final, powerful pause right before the surgery is about to start.
And that pause is called the timeout. And it's exactly what it sounds like. Everything in the operating room stops. The entire team, surgeon, nurse, anesthesiologist, everyone, stops what they're doing and verbally confirms, out loud, that they have the right patient for the right procedure on the correct site. It is the last, and most important, safety net.
Now for our final goal, goal number 5. This one takes on an invisible but constant danger in any hospital or clinic, the risk of infection. And what's really amazing here is how simple the core idea is. I mean, infection control is this huge, complicated field, but one of the single most effective weapons we have against it all comes down to one basic practice: clean hands.
Now, to make that happen, it's about more than just putting up a poster. Hospitals have a whole hand hygiene program based on official guidelines. That means making sure soap and hand sanitizer are everywhere they need to be, constantly training staff on the right way to wash their hands, and this is key, actually monitoring them to make sure the rules are being followed every single time. So, as you can see, when you put it all together, this isn't just a random list of rules. From identifying you correctly, all the way to hand washing, each goal is like another layer of protection. And together, they create this really strong, overlapping system of safety nets, all designed to catch any potential problems and protect patients from harm.
And that's what's so empowering about understanding this system. It really changes your role from just being a passive patient to being an active, informed partner in your own care. Knowing why the nurse is asking your name for the 10th time, or seeing the surgeon mark the surgical site, it gives you the knowledge and the confidence to speak up if something doesn't feel right. It makes you a final and absolutely crucial member of your own safety team.